Hello, welcome to ICUBA's first virtual health fair. My name is Rachel Mangus and I'm the Director of Operations over at ICUBA. Today I'll be covering benefit plan year April 1st, 2020 to March 31st, 2021. Meet Anna. We're hoping that you'll join us for a trip around our virtual health fair. We're going to stop by and visit many brand partners today and learn a little bit more about the benefits that are offered through ICUBA. At the end of the presentation, you'll have the opportunity to take a quiz and earn credit for an on-site event. The first stop is ICUBA. ICUBA is celebrating 18 years of service to 26 private Florida education employers, bringing you better benefits through collaboration. We're very excited that all of you are member institutions, and we hope you enjoy the benefits that we bring to you. IT, the benefits team, and ICUBA worked hard to develop a single sign-on into ICUBAbenefits.org using your buried credentials. There are two easy ways to access the single sign-on. One way is to go through Workday, where you will click on External Resource Links and then click on the link that says ICUBA Benefits Portal. The second point of access is through go.berry.edu, where you will find ICUBA Benefits Portal tile. Click and enter ICUBAbenefits.org with no additional password necessary. Once you're in ICUBAbenefits.org, you will see a section called My Carrier Accounts. From here, you can enter your carrier websites through ICUBA's single sign-on feature. Click on My Health Toolkit portal and you will be directed to the Blue Cross Blue Shield website or visit any of the carriers listed. You want to log in from another device? It's easy. Visit ICUBAbenefits.org and enter your username and password. If you forget your username and password, don't worry. There's a reminder at the bottom of the screen. Your username is always your first initial, your last name, and the last 4 digits of your social security number. If you forget your password, there's no need to worry there either. You can simply click the Forgot Password link for more assistance, or call Be Swift at the number listed at the bottom corner. One helpful tip I like to share at health fairs is my ICUBA folder on my cell phone. I have a folder full of mobile apps that represent ICUBA with the medical, prescription drugs, well-being incentives through Rally, labs and biometrics, and even the EAP. So visit your app store and download these apps today. You might be wondering, why do I have so many cards? Well, included with your medical premiums, you gain access to comprehensive medical, prescription drugs, and behavioral health. Our medical plan also comes with several perks, such as Rally Wellbeing Initiatives, ICUBA Cares Pharmacy Advocates, and Surgery Plus, which is non-emergent surgery. We'll cover these in a lot more detail as we proceed through our virtual health fair. You might be wondering, why is the insurance company calling me? Well, ICUBA has partnered with Blue Cross Blue Shield, Optum, ICUBA Cares, and Aetna to reach out to you and help you manage a chronic health condition. We're actually calling because we care. These are trained health advisors and registered nurses that can provide tools and education to help you manage your chronic health condition. It's also important to have the correct contact information at ICUBAbenefits.org. If you don't have updated information, make sure you reach out to your HR department to update it. The second stop on our journey is Blue Cross Blue Shield of Florida. Let's go. ICUBA prides ourselves in breaking down barriers to care. This slide, while busy, provides a list of services and how they will or will not apply to your deductible. Services on the far left will always be no cost to our members. Preventive services like mammograms and colonoscopies, immunizations, and medically necessary labs at Quest, just to name a few. These will always be $0. The middle column represents items that will not be subject to the deductible, meaning you will only owe a copay or coinsurance when receiving these services. For instance, visiting a specialist or picking up a prescription at the pharmacy. Last, the column on the far right These are what we consider the more major services and are always subject to the deductible before the coinsurance will apply. If you have additional questions, these details can be reviewed on the individual plan summaries from Blue Cross Blue Shield and the other brand partners. Do you have the My Health Toolkit mobile app? If you don't, you should. This is Blue Cross Blue Shield's mobile app and is super user-friendly. It's like having the My Health Toolkit webpage in your pocket at all times. You can save your ID card right to the front, so you don't even have to log in if there's no service in the doctor's office. You can enable your Touch ID for this mobile app. You can also view helpful information in the mobile app and get real-time data, and you can view claims to see how much you may or may not owe your physicians when you're at the office. Care Connected is in your corner. Just a reminder, this is the customer service number on the back of your Blue Cross Blue Shield ID card. They can help with claims questions, they can give you concierge assistance for billing, assist in finding a total care provider, provide lifestyle coaching or connect you with a coach, and also help you with chronic condition coaching. So just a reminder, this number is listed on the back of your Blue Cross Blue Shield ID card. Also, we wanted to highlight the free visits at total care providers. These primary care total care providers are always $0. The branding has changed a little bit, but when you're looking for a physician, just look for that total care mark. All medically necessary services from family practice, internal medicine, and pediatric offices at a total care provider are always free. So you might ask, why total care? Total Care's improved screening, medication management, and other programs help provide better outcomes at a lower cost to the patients. And in ICUBA's case, these are always free to our members using the Total Care family practice, internal medicine, and pediatric providers. So why wouldn't you? The total care providers must meet rigorous quality standards to be a part of this special designation of physicians with the Blue Cross Blue Shield network. So as I mentioned, just look for that Total Care logo when searching providers. Sanitas is a new, exciting partner that we have with Blue Cross Blue Shield. This is complete medical care for your entire family. You can receive all your preventive care needs in one place, including checkups, annual wellness physicals, child wealth visits, and vaccinations. And the primary care physicians at Sanitas clinics are always total care providers. You can also get labs and diagnostic imaging done on site, treatment for chronic conditions such as diabetes, COPD, high blood pressure. They also take walk-ins for urgent care and provide telehealth with their doctors through video on a mobile, tablet, or computer. They have their own mobile app, which you will be connected to with My Sanitas chat app, where it gives you the ability to message with a doctor for any medical questions or concerns. So if you haven't checked out a Sanitas Medical Center, we encourage you to do so. Have you registered for Teladoc? If you're thinking about using this benefit, it's important to register in advance. When you complete the registration, it'll ask you questions similar to the paperwork that you fill out when you're visiting a new doctor's office. They just need to know your medical history, since this is also a doctor's visit, just a different kind. When can you use Teladoc? Well, when you need care now. If you're considering an ER or urgent care visit for a non-emergent issue, if you're on vacation, on a business trip, or away from home, or if you need a short-term medication refill. These are all great times to use Teladoc. It's important to know that Teladoc does not replace your relationship with your primary care physician. It's just a convenient and affordable option for quality care. We want you to get the care you need, so if you have a cold and flu symptoms, allergy, bronchitis, a UTI, or respiratory infection, these are great reasons to call Teladoc. The doctors are real doctors. The doctor requirements for Teladoc, they are practicing physicians, pediatricians, and family medicine doctors, averaging 15 years of experience. They're all US board certified and licensed in your state, and are credentialed every 3 years, meeting the NCQA standards. Teladoc is only a $5 copay and is not subject to the deductible, so it's also a very reasonable alternative to urgent care. Next up on our health fair journey, we're going to visit OptinRx and ICUBA Care's Pharmacist Advocate Program. This is just a snapshot of ICUBA's prescription drug plan that comes with the medical premiums that you pay. We have this tiered structure. Depending on the medication that you're taking, they will fall in a tier which will also match up to the copay that you'll pay at the pharmacy. We offer 30-day retail, or we offer 90-day retail or mail order. Just a reminder that a 90-day supply will save you money. We wanted to highlight also the prescription drug freebies and prescription drug out-of-pocket maximum. The prescription drug freebies are with a prescription. Any diabetic supplies, including meters, lancing devices, lancets, and the other items, are free to you with a prescription. Also, prescribed aspirin for adults, prescribed generic folic acid and generic prenatal vitamins for pregnancy, and prescribed generic statins if you're eligible. We also have a separate out-of-pocket maximum on our prescription drug plan just to protect you. So you'll never pay more than $2,000 for an individual or $4,000 for family. Under the opt-in benefits, you can also decide to quit using tobacco. You can choose a program that works for you and have your prescription and over-the-counter tobacco cessation program to help you quit. This program covers up to 2 cycles per year at no cost to you. $0 preventive drugs for chronic condition. This is new, effective July 1st. ICUBA is now offering $0 preventive medications for chronic conditions. These conditions include medications for preventing blood clots and reducing the risk of stroke, preventing heart disease and reducing the risk of high blood pressure, and preventing osteoporosis. If you have one of these conditions, we just want you to make sure that you're staying on top of your medication regimen, and that's why we have removed the copay. The ICUBA Cares Pharmacy Advocate team is also here to help. Our ICUBA Cares Pharmacist team is ready to serve as the liaison between your doctor, the pharmacy, and the insurance company, taking the burden off of you. They can also answer questions on a medication that you're taking or considering, providing useful information on side effects and drug interactions. They can discuss preferred and non-preferred tier options to help save you money. And they can provide assistance for prior authorizations from your provider. So if you have questions about your pharmacy benefits or how they might work, you can give the ICUBA Cares Pharmacy team a call today. Next up on our stop, Aetna for behavioral health and our EAP through Resources for Living. What does Aetna insurance actually cover? Well, they cover behavioral health and substance abuse, including professional counseling where you can speak with a licensed clinician to manage a diagnosed behavioral health condition. You can take advantage of over-the-phone, televideo, or in-office visits. They also provide medication evaluations for diagnosed behavioral health conditions and those ABA services for autism spectrum disorder. They also have more intensive services like hospitalization, detoxification, and residential treatment. If you have any questions for Aetna, we encourage you to give them a call at the number listed on the screen. Option 1 is for the EAP and option 2 is for behavioral health. Along with the medical plan, our members have access to Aetna's Able To program. This pairs a therapist and a behavior coach for an 8-week period of time, totaling 16 sessions. So if you have one of these life or health issues or conditions listed on the left-hand side, we really encourage you to take advantage of this free program. You choose how you want to meet. It is a web-based video conferencing or telephone appointment. You meet once a week with a therapist and once a week with a behavior coach just to identify health goals and develop an action plan. Again, this is an 8-week program over 16 sessions. The Employee Assistance Program for everyone. This is everybody, not only if you're enrolled in the medical plan. The Employee Assistance Program covers emotional well-being support, daily life assistance, legal services, financial services, and much more. You can also visit their website at resourcesforliving.com. The username is ICUBA, and the password is their phone number, without the 1 and without the dashes. Every call made to the EAP is free and confidential. The first bucket that we talked about is the emotional, where you're going to visit with a counselor regarding a life event or to obtain an objective expert point of view over the phone, televideo, or in the office. You have access to up to 6 free sessions per issue per year for every member of your household. Items like coping with COVID-19, relationship support, stress management, work-life balance, family issues, grief and loss, depression, anxiety, substance misuse, self-esteem, and personal development are all reasons why you could call the EAP for emotional support. The EAP also covers just general life items. Completing day-to-day needs can make it tough to know where to start. The EAP can kind of give you a little personal assistant in your pocket. Resources for Living will help you find resources for anything life throws at you, like childcare, parenting and adoption, summer programs, school and financial aid research, care for older adults, caregiver support, special needs, pet care, home repair and home improvement, and household services. Who knew they would help you find somebody to mow your lawn? The Employee Assistance Program also provides legal services. You can gain access to a wide array of legal items, online legal documents, and receive a 30-minute consultation for each legal topic, including general, family, criminal law, elder law and estate planning, divorce, wills and other documents, real estate transaction, and mediation services. And remember, every call to the EAP is free and confidential. Financial services are also available, so you can gain access to a wide array of financial tips and also receive 30-minute consultation for each new financial topic, including budgeting, retirement or other financial planning, mortgages and refinancing, credit and debt issues, college funding, and tax and IRS questions and preparation. And it's free and confidential. I'm really busy. Can I text instead of calling? Absolutely. Through Talkspace, text messaging is available. Talkspace is an online therapy platform that makes mental health care more convenient and accessible by connecting users with licensed therapists. On average, 1 week of Talkspace messaging equals 1 EAP session. You can send unlimited multimedia messages, including text, audio, picture, and video messages to a therapist via a web browser or the Talkspace mobile app. And you can expect to hear back from your therapist within 1 working day during business hours, 5 days per week. So it's not that immediate gratification that you get from text messaging with a friend, but it does give you that convenience of not having to actually talk to anybody on the phone or schedule that time. You can do this on your own time. You will have to call for authorization and then register at Talkspace.com/RFL. The organization name is your employer or school. Next up, we're going to stop by and visit Surgery Plus. Surgery Plus provides access to high-quality surgeons. Your Surgery Plus benefits are paired with the medical plan. This is kind of a freebie add-on, if you will. The standards that Surgery Plus puts into their Surgeons of Excellence network are above the rest. The surgeons are licensed, board certified, fellowship trained, and screened for malpractice sanctions and criminal records. The surgeries that are covered by the Surgery Plus benefit are those non-emergent but medically necessary services. So if you need a knee replacement, a shoulder surgery, a wrist or elbow, general surgery, bariatric, cardiac, those are the types of services that you will call Surgery Plus. There is a financial incentive for going through our partners over at Surgery Plus. Your deductible and co-insurance are waived. So your procedure is at no cost to you, and the travel benefits, if necessary, are included. So call and set up consultation with a care advocate for more information. This also comes with a full service concierge, so they can locate the best fitting surgeon for your needs. They can schedule timely appointments. They'll coordinate medical record transfers and schedule any follow-up care as needed. Up next, we are going to walk through ICUBA's well-being program with Rally. Let's go. Everybody knows all about the Rally incentives. The Rally survey is still the gatekeeper, and then we have some increased incentives this year. The wellness exam is $60 gift card incentive. A biometric screening will earn you $40 this year. There's on-site campus events. You can participate in up to 7 for $10 each. The preventive exams are $50 for the first claim process for a PSA, colonoscopy, or mammogram. The ICUBA Cares qualified medication change is $50. And we still are providing coins and private sweepstakes for missions, challenges, and some other items. And just a fun feel-good fact, we shared this at open enrollment, but ICUBA members donated more than 4 million coins to charity last year. That's pretty awesome. So the Rally survey is the gatekeeper. What exactly does that mean? That means a task is required in order for you to earn a reward. So get in there and complete that Rally survey so you can unlock your other rewards that are pending. If you don't know how to do it, the first time that you log into Rally after April, it gives you this screen and you just agree to get started. If you clicked at the top and said not now, then there's still an opportunity. On your home page or your dashboard, you can retake the survey. If this prompt is not on your dashboard, there's a few other options for you as well. Next to your name at the top bar, you can click on this little panel and it will open your profile. Then you can click on Retake Survey. We're really excited this year to introduce the physician results form for the biometrics. There's no more finger pricks or additional blood draws that are needed. ICUBA members can earn incentives for a biometric screening by visiting your own physician and completing the blood work that they want to see anyway. We're going to take you through the steps now. So how do you get credit for completing your biometrics in Rally? First, employees and spouses enrolled in the ICUBA medical plan can visit your individual portal at my.questforhealth.com and download the physician results form. This is going to be the same website that you've previously logged into to register for on-site biometric screenings. The physician results form contains a barcode specific to the employee or spouse and cannot be shared. This form is unique to you. Want a pro tip? If you have an established relationship with your physician, you can request your blood work ahead of your annual wellness exam to save time and check this one off your list with one visit. Just be sure that the annual blood work includes cholesterol, HDL, LDL, triglycerides, blood sugar, blood pressure, and A1C. Your doctor will also need to measure your waist while you're there. Remember to take the form with you to your annual physical. It is important that both you and your doctor sign the Quest Physician Results form. Then your doctor's office can fax it to the number found on the form. You're also encouraged to request a copy for your own records, and if necessary, you can upload or fax the form to the Quest portal on your own. Members should allow at least 30 days after the form is uploaded or faxed to Rally to see credit. And remember, the final deadline for submission to Quest is no later than March 31st, 2021. So get going. A few other Rally reminders. Just a reminder that the clinical rewards is there to help you manage chronic conditions. This program provides members with chronic conditions just additional education materials, including asthma, COPD, diabetes, coronary artery disease, congestive heart failure, hypertension, and hyperlipidemia. And by participating with educational materials each quarter, you can earn 500 coins per quarter and 2,000 coins per year. We also want to remind everybody to participate in those city challenges, which will enter you into the private sweepstakes. ICUBA is giving away $50 Amazon incentives every 14 days. So when you earn a cross-city challenge milestone, not only will you earn coins as you sync your tracking device, but you'll be entered for a chance to win every single time that milestone is reached. There are no limits or restrictions, and multiple entries are permitted. In fact, we have repeat winners already. So if you are interested in a $50 Amazon gift card, download the mobile app and get started. So just what is the value of the Blue Rewards Powered by Rally program? Well, let's take a look at Anna's experience. Anna downloaded the Blue Cross Blue Shield mobile app and was able to locate a total care provider. She got an annual physical for her total care primary care doctor for free, and it earned her $60. Her primary care physician submitted the Quest physician results form, earning her an additional $40 just by getting her standard blood work done. At work, Anna participated in 2 on-site events totaling $20, and she's really hoping for 5 more. During her recent doctor's appointment, Anna was diagnosed as a diabetic. She connected with a Blue Cross Blue Shield health coach, and through Rally's clinical rewards, is able to help control her condition a little bit better with those educational materials. To date, she has earned $120 in Rally rewards and has donated 3,000 coins to various Rally charities. Way to go, Anna! Continuing on in our virtual health fair, we're going to visit Humana. Humana wants to remind you to make regular dental visits a priority. How dental health affects the heart. Gum disease occurs when the tissue around your teeth becomes infected. Bacteria found in gum disease can increase the risk for heart attack or stroke. Also, if left untreated, gum disease can damage the gums and bone around your teeth and eventually can cause tooth loss. Also, some tips to help ensure that you have a healthy mouth. Use a soft bristled toothbrush, choose toothpaste with fluoride, brush for at least 2 minutes twice a day, floss daily, watch for signs of periodontal disease such as red, swollen, or tender gums, and visit a dentist regularly for exams and cleanings. Just a side note, preventive cleanings are covered under the Humana plans free of charge. So what can you do? See a dentist. Make regular dental visits a priority, and if you have a heart disease, it's important to tell your dentist, including any medications that you're currently taking. A dentist may be able to recognize early oral health problems that you can't see and provide appropriate treatment to help slow the progression of the disease. Practice good dental care every day. Dental care is always important, but even more of a priority if you have heart disease. Healthy gums help prevent bacteria in your mouth from entering your bloodstream, keeping you healthier. You can take an oral health risk assessment called My Dental IQ that immediately provides feedback regarding your oral health. You'll receive a personalized action plan with health tips. You can print a copy of your summary and discuss this with your dentist at your next visit. This dental IQ quiz can be found at humana.com. Coverage details, ID card, and claims? Don't worry. You have access to all things dental at the Humana portal via this ICUBA single sign-on. The My Humana account is very easily accessible. You can view coverage details, your plan summaries. You can view and print your ID card. You can email it, or you can request a card be mailed to you. You can also view your recent claims. The 3 most recent claims will be shown, and then you can also click See All Claims to research a past historical claim. Or you can get help. Humana is always standing by. You can chat with them through the Let's Chat feature in the website, or you can contact the Customer Care Center. Next up on ICUBA's Virtual Health Fair, we're going to visit IMED. IMED offers convenient online shopping. You can shop and buy frames, contact lenses, and sunglasses just like you would in the store, but from your computer, smartphone, or tablet. It's fast, easy, and it's built into your vision benefits. You can choose from hundreds of brand name frames and contacts, instantly apply your in-network benefits at checkout, and enjoy free shipping and return. This is available at LensCrafters, Target Optical, Ray-Ban, Glasses.com, and Contacts Direct. Do you need a current prescription? The provider locator on IMED.com and the IMED member app can help you find the right place for an eye exam. Some additional online resources, or just to dig in a little bit deeper, for Contacts Direct and Glasses.com is here on the screen. You can visit contactsdirect.com and purchase contact lenses from a wide variety of top-selling brands with your in-network benefits instantly applied and your contact lenses shipped right to your door. With Glasses.com, you can purchase glasses online and make sure that they look good before they're mailed to you. You can virtually try on glasses before you buy them with the facial recognition 3D technology. If you haven't tried this, it's pretty cool. They have a huge selection of frames and lenses, including the world's leading brands, and again, all in-network benefits are applied directly in your shopping cart. Just a reminder, if you don't need new glasses, make sure that you're cashing in on the IMED discounts. You can get 40% off an additional complete pair of prescription eyeglasses, or 20% off not covered items like non-prescription sunglasses. Now we're going to go into Aflac's portion of the Virtual Health Fair. The first thing that we want to remind you is how to file a claim with Aflac. If you elected one of the Aflac benefits at open enrollment, you might be wondering, well, I have this benefit, but I'm not sure really what to do with it. So we're going to review the benefits again after this slide, but how do you file a claim online? You just simply visit aflacgroupinsurance.com, select customer service, and then file a claim. Please note, very specific documentation is required for the various claims that you're submitting, such as itemized bills, and the specifics for your claim are listed on the website. So pay close attention when you're submitting your information. Just click on the File a Claim button. So the coverages that you might have elected at open enrollment include critical illness, which is cancer, heart attack, sudden cardiac arrest, coronary artery bypass, organ transplant, bone marrow transplant, kidney failure, or stroke. These pay a lump sum cash benefit to you. They pay in addition to other insurance coverage, and if you don't have a critical illness, you can make sure that you're cashing in on that $50 annual screening benefit that will apply. Also, the hospital indemnity. The hospital indemnity pays for an hospital admission or confinement due to an accident or illness. It pays a lump sum cash benefit to you in addition to other insurance coverage. And we offered it in 2 tiers, a high and a low plan. So make sure that you know which plan you're on before you file a claim. Last, we offer the group accident plan with Aflac. So if you have one of these accidents where you visit the ER or urgent care, need an ambulance ride, or suffer one of these other ailments, which is the cause of an accident, you make sure that you are cashing in on these benefits as well. This also comes with an annual health screening benefit that still applies. So if you are fortunate enough to not experience an accident, make sure that you're redeeming that annual health screening benefit. Thank you so much for attending our ICUBA's Virtual Health Fair. We hope you found this information very useful. Please don't forget to complete the on-site event quiz for credit so we can award you with that $10 incentive. You can follow the URL that's listed here, or you can scan this QR code to complete the quiz. You will need your Blue Cross Blue Shield ID number handy, because that is how we're going to award you those dollars. A satisfactory score of 80% or higher is required on that quiz. So best of luck, and if you have any questions, please don't hesitate to contact us. Thank you and have a great semester.